In October of 2016, I started bleeding, and I knew that there was something wrong because I hadn't bled in quite a while. I called Dr. Sarah Wagner and made an appointment.
And we evaluated her with ultrasound and biopsy, which both of those tests were absolutely reassuring. Everything looked really good. So we decided to watch and see if the bleeding recurred, and it did. And so for Maria, we decided to go ahead and proceed with hysterectomy. We removed Maria's uterus. We asked the pathologist to take a look at the uterus prior to finishing her surgery, just to be sure that I wasn't missing a cancer that had been missed on the biopsy. Turned out that there actually was a cancer in the uterus that the pathologist identified.
That's when she called me in to do the surgical staging. With the staging, you can either be at low risk, which usually requires no additional treatment. This patient turned into what we would call high intermediate risk because it had grown more than halfway through the uterine wall. Those patients, we feel, benefit from some local radiation.
I told them I wanted them to be aggressive. And then I proceeded to have 4 rounds of the radiation.
What we look at for radiation is there a risk of it coming back? And if there is a risk, where would it come back most often, and what can we do to prevent that? So for Miss Liberty, she had an intermediate risk cancer, which means most of the time it would not come back. But sometimes if it does come back, the most common place for it to come back is right at the top of the vagina. It's called the vaginal cuff. And through various research, including some of the trials we've done, it shows that if by giving radiation just to that area, you significantly reduce the risk of it coming back with very little toxicity.
Her prognosis is excellent. I mean, with the radiation, her risk of recurrence is on the order of 1 or 2%.
Communication back to me has been just something that really makes me happy to work with these other doctors as well. I hear back from them as soon as they evaluate the patient, as soon as they see the patient, I receive communication from them.
I think it's a special center not only for this type, but pretty much all cancers. And one of the things that makes us truly unique is we really do have multidisciplinary care, which means I see the patient with my collaborators. The ability to see the patient together, interact together with the patient, do exams together with the patient, I think raises a level of care that is unmatched.
I've had such a positive experience with all 3 doctors. It was really great.